Okay, so colleagues, welcome to our ECHO session today. We are just at the top of the hour. My name is Francis Ochen from the African Society for Laboratory Medicine, and I'll be your moderator today. Our session is the usual one, and we'll run it for 1 hour. We'll take one shared presentation and get into the questions and answers. Kindly join the discussions through the chat. We encourage you not to share your personal details in the chat, whether it's your email addresses or phone numbers, for just your data security. The information that we gather during registration is adequate for us, and we do not need additional information shared on the chat. So the chat is just for your questions, comments, and counter responses. We do have language interpretation services. Please keep to either English, French, or Portuguese so that you can then benefit from that service available to you. Our session slides and recordings will be made available at the end of this session through our various media platforms. The Lab System Strengthening Community of Practice, as you know, is a project that is funded by the Bill and Melinda Gates Foundation and is implemented by ASLM and partners. And currently, we are supporting 24 countries, and this number will continue to go up on the continent. Among the key project focus areas is really the periodic assessment of country-level capacities and the performance of national lab networks. And results from some of these assessments will always allow us to objectively identify gaps and prioritize them for redress at the country level. And one performance area or domain that remains really suboptimal across a good number of countries is supply chain and equipment management. And so to support countries in optimizing procurement and supply chain, ASLM, in collaboration with USAID Global Health Supply Chain, the Procurement and Supply Management project, will convene some sessions that are really focusing on this area. So in today's session, where we do the first of the many that will come in this series, we will be sharing with you the PEPFAR's experience in establishing molecular instrument-based service level agreements with global diagnostic manufacturers for viral load and early infant diagnostic testing. The presentation will take us through the concept of all-inclusive reagent rental models, essential elements of the service level agreements, and some key lessons learned through nearly 5 years of service level agreement implementation in a number of countries that are supported by PEPFAR. And colleagues, to take us through this, we have 3 presenters. The first is going to be Jason Williams, and Jason is the technical lab lead with the Global Health Office of HIV and AIDS and Supply Chain at USAID Washington. And then the second presenter will be Yulia Johnson, and Yulia is a Global Viral Load Team Lead, still with the Global Health Supply Chain, Procurement and Supplies Management Project. And last but not least, we will have Fadzai Maranch, and Fadzai is a Senior Diagnostic Advisor, still with the Global Health Supply Chain and Procurement Supplies Management Project. So colleagues, allow me now introduce to us Jason Williams, who will be the first speaker before we take the other 2 speakers. Jason, over to you.
So thank you for that, Francis. So again, my name is Jason Williams. I'm the technical lab lead within the Office of HIV/AIDS, within the Global Health Bureau Supply Chain Division at USAID Washington. I serve as the lead technical person for the implementation of the procurement of lab products under PEPFAR, and also serve as a co-lead for the PEPFAR lab TWG. This is a wonderful opportunity. I'm glad that we have so many folks attending from such a diverse group of countries. More recently, we've actually held a workshop in Addis, and this is one of the reasons why we're actually hosting this additional webinar through ASLM. We had an opportunity to engage with Collins, who is a member of ASLM as part of the program there, and thought that this would be a great idea and an opportunity to expand or at least demonstrate some things that we have learned over the past 5 years within PEPFAR and moving towards reagent rental all-inclusive agreements. I'm happy to see that there's a diverse group of countries. Actually, some of the countries on the call actually do execute all-inclusive agreements through PEPFAR, which is great. And I do see, as part of the May training in Addis, there are quite a few of the countries represented on the call that did have representation as part of that workshop. So hopefully this will be a refresh for a lot of those folks, and hopefully there's a lot of other colleagues on the call that this may be new to, but hopefully, as alluded to by Francis, this is one of hopefully many webinars that we can facilitate through ASLM to demystify kind of the approaches that we see under all-inclusive agreements. For most of you, and this was a struggle for us about 4 or 5 years ago, we have a lot of supply chain instrument-related challenges. And historically, we had pricing variability and little leverage when pricing and contracts were negotiated at a country level. So we really shifted our approach and moved to a more holistic procurement strategy under PEPFAR, advocating for all-inclusive agreements and standardized pricing across countries. I'm not going to get into too much of the specifics of those agreements because Fadzai and Yulia will speak to those, but just to say that over the past 5 years, we've seen significant gains and an improved collaboration with the manufacturers as part of addressing some of these existing challenges that a lot of folks on this call are probably experiencing, whether it's high instrument failures, high error codes, long downtimes, and just pricing variability and fragmentation of procurement strategies in country. So for those that do actively engage at PEPFAR at a higher level, hopefully we have some folks that are part of upper leadership too, as well as lab directors and other folks that reside in labs. Folks are aware of this strategy. It is part of our core principles within PEPFAR in moving in this direction. And we're hoping that this is a really good opportunity to folks to get a better appreciation of what we're talking about. There's a lot of misunderstanding about service level agreements, what they can do, what they can't do, how to manage them, how to monitor them, how to negotiate pricing, those sorts of things that hopefully will become a little more visible, and hopefully folks can appreciate and understand them a little more following the conclusion of this presentation. So with that being said, again, we're using this as an opportunity to expand knowledge, share information, share lessons learned, and hopefully assist with folks having a greater appreciation of the overall approach. And hopefully folks can take this back to leadership if you're not part of it and explain and further advocate for potentially moving in this direction if you are experiencing challenges as part of procurement, even instrument placement strategies, and more broadly, service provision from the manufacturers that are integrated into your lab network as part of your instrument coverage. So with that, I would like to hand it over to our next speaker. But again, I would like to thank everyone for joining the call this morning or this afternoon, or wherever you are located, globally. And hopefully you can take some learning from this presentation. And like I said, there will be a follow-up presentation that will a little bit deeper into additional elements in the near future. So with that, I'd like to hand it over to my colleagues to continue with the slide deck and move forward with some of the broader background and more specifics of the content of the presentation. So thank you so much.
Thank you, Jason, for this introductory remarks. So as Francis said, my name is Julia Johansson. I am the Global Viral Load Team Lead with the Procurement and Supply Management project of USAID. And it is the Global Viral Load team who's been behind managing of this all-inclusive reagent rental model that we're going to talk about today. Our agenda for this presentation, which is going to take about 30 minutes, is in front of you. We'll start by kind of finishing what Jason has started doing, setting the context for this presentation and sharing some key background information, and talk about the common challenges that I experienced in the HIV viral load testing space. Then we will take you through the evolution of PEPFAR's all-inclusive reagent rental model, after which we will talk to you about what service level agreements are and what are the key elements of PEPFAR's SLAs. Then we will share with you achievements and lessons learned and our recommendations for implementation of SLAs to those of you who are interested in carrying out this model in your respective countries. And lastly, we will talk about next steps and hopefully more sessions that USAID and the PSM project can deliver for ASLM's laboratory community of practice. And it is my pleasure and privilege to speaking to you today. So hopefully you will find it useful. Our objectives for today are listed here. First, we will talk to you, we want to share with you our experience on how we conducted 2 global tenders requests for proposal among primary diagnostics suppliers on behalf of PEPFAR, and how we negotiate global SLAs. I can see in the audience we have some representation from our business partners from the supplier side. It's great to have you with us today too. Then, as I said, we'll share our lessons and expertise that we acquired through this implementation. And I think we have credentials to speak about that, because our experience is both extensive in terms of the time we spent doing that and in terms of a number of countries that this initiative has successfully covered. And our greatest hope is that it will help you. You'll find this content relevant, and it will help you to accelerate adoption of service level agreements and improve supplies performance with your manufacturers and their distribution partners. With that, let's go into the first section of our presentation. So this is the background. You already heard some of these points from Jason's opening remarks. But the main driver behind PEPFAR's efforts to improve price transparency and service performance and to build healthy supplies market is to use those tools to transform molecular laboratory testing space and provide cost-effective and efficient services to our patients for better health outcomes. So the journey started 5 years ago with the first, what we call the first global RFP, first tender for viral load, HIV viral load, and early infant diagnosis testing. And through that RFP, we established global price for reagents and consumables, as well as service price for 6 highest volume PEPFAR-supported countries, and I'll get back to details of that. 4 years later, we concluded the second, what we call the Wave 2 RFP, whereby the same benefits in terms of all-inclusive service pricing have been extended to the remainder of the PEPFAR-supported universe. That's another 42 countries we're talking here. And so now this all-inclusive pricing and service terms for viral load and EID testing are available to all buyers with PEPFAR funding. The arrangement that we're talking about includes reagents and consumables, which are required to conduct viral load and EID test. It includes diagnostic and instrument lease, installation, maintenance of that equipment, training of end users of the equipment, and then supply chain services, as well as reporting of instrument data. And the key benefits of SLA implementation is standardization of those services and contract terms across procurement agencies and donors, and harmonized mechanisms to manage supplies performance, as well as substantial or potential, but in case of PEPFAR, substantial financial savings, which we're also going to talk about. If we can proceed to next slide. So before I go into more details, I just want to make this remark about what specific form or process for viral load testing PEPFAR has been supporting so far through the all-inclusive reagent rental model. As you professionals know, there are two key processes how the viral load testing can be conducted. It can be done at a national or regional lab on a high-through instruments, and the protocol or sequence of actions to conduct such as the here in front of you on this screen. And the other common way to conduct viral load and AID testing is at the clinic at the point of care, on a point of care instruments. So since about 90 to 95% of testing done in PEPFAR countries is done in centralized labs, it was decided that the model will be tested, will be launched for this type of testing in order to achieve the biggest impact. So let's keep this in mind as we go through our presentation. In the next slide, you can see a list of, not exhaustive, unfortunately, but I think key challenges are that many of countries in the ASLM lab community of practice, as well as PEPFAR supported procurement agents and programs experience, they are unfortunately typical and in many cases are persistent. So one of them is lack of national strategy for viral load procurement, and laboratories are left to procure reagents through a variety assortment of fragmented systems. Reagents and consumables often get stocked out. We have cases of procurement of equipment with naturally very large capital investment in such equipment, but without service contracts or without lasting service contracts. Lack of standard national plan for equipment maintenance or lack of national contracts for maintenance result in backlogs of samples to be tested because equipment is down. And where we do have maintenance contracts in place, there are often no effective mechanisms to enforce the terms of the contracts and approve or monitor even performance of service providers. And lastly, but not least, is some countries have too many instruments, excess capacity with low utilization, which is of course a problem from many perspectives. So in the next slide, I want to emphasize that we understand that the problems that PEPFAR has experienced in our experiment, in our initiative, Global Viral Load Initiative, they are by no means unique, and that many of you experience the same problems with supply chain and equipment maintenance as PEPFAR used to have. This is an excerpt from, it's a summary of the self-assessment of viral load testing space that was conducted in your community of practice between 2019 and 2022. And it does show that supply chain management and equipment maintenance areas have the lowest level of maturity across all dimensions that participants were asked to self-assess themselves. So 75% of respondents described their maturity in these areas as either low or foundational. So in the next slide, we will tell you how PEPFAR tackled these challenges. So first, let me discuss it at the strategic level. So strategically and holistically, PEPFAR adopted an innovative approach to strategic procurement of commodities and services in the space, which we refer to as the all-inclusive reagent rental model. And that strategy and that concept led to establishing service level agreements with global suppliers. So the challenges that I have already covered, and Jason mentioned it also in his opening remarks, are listed on the left, but I want to talk to you about what strategies we employed to address them. So we developed standardized all-inclusive service package for suppliers to bid during the process of our global tenders, to bid for all PEPFAR-supported countries. And then we established standardized service agreements and KPI tracking with a regular supplier performance dialogue, which made suppliers contractually accountable, not only for their own performance, but also for performance of their distributors. We know that only the good decisions can only be made based on the good data. So lack of data, instrument performance data and supply performance data, and lack of transparency into that data was addressed by requiring suppliers to enable automated reporting of operational data from their instruments back to themselves and back to PEPFAR and back to end users in host countries. And high variation of pricing that Jason also mentioned has been addressed through a three-pronged approach. First of all, PEPFAR had the power to aggregate all its spend and maximize its buying, negotiating power with suppliers. Then, in order to improve the market dynamics and market health, we enabled entrance of a new supplier to promote competition, which is often a very, very good thing to improve the market health. And lastly, the approach to pricing was restructured, whereby we required suppliers to bid a single global price for reagent consumables for all countries. We asked for all-inclusive price per test or per patient test. We insisted to see the composition of that price, so price transparency for individual country services. And lastly, we were able to negotiate volume-based discounts. In the next slide, we can go even at the next level. So I discussed the strategy. Now let's look at the tactics that we employed, which also kind of fed into these service level agreements that we concluded. So instead of buying equipment and ending up in many cases with equipment graveyards, PEPFAR adopted leasing-only approach instead of outright purchase, and which also included upgrading of all the equipment, of all the technologies as well. Too many instruments, excess capacity can be addressed tactically by enforcing minimum utilization requirements before an instrument can be installed, and also think about multiplexing and integration of testing on the same platform. As I said, instead of buying commodities only, we're now procuring commodities and services. And that's all included in the cost per patient test per test for reagents, consumables, controls, also accounting for some wastages. The problem with prolonged downtime and overdue maintenance is addressed through maintenance, very explicit maintenance terms and KPIs to measure them. Stock out of reagents and consumables, it's a big problem, and as you'll see later, SLA cannot solve it completely, but one of the ways to solve it through SLAs is to shift more responsibilities for supply chain management and inventory management to vendors, and countries can consider, or buyer who enters the SLA agreement can consider using different Incoterms, or even develop a vendor-managed inventory solution together with your supplier. And lastly, data systems that were not available or were minimally integrated with decision-making process now can be addressed through holistic approach to data ecosystems, where there is interfaces between health information systems, lab information systems, instruments, and use of KPI data that is flowing regularly. So now I want to kind of descending to a next level of our, before we descend to next level of our discussion of KPIs, I want to give you this snapshot in the form of a timeline of our journey implementing this program. We are now in the 5th year of its implementation. It all started in 2019 with the first RFP, the program, signing of first wave of global SLAs happened in early 2020, and we started putting in place implementation mechanisms in 6 largest countries, largest in terms of PEPFAR support for viral testing. And those countries are Nigeria, Mozambique, Uganda, Tanzania, Kenya, and Zambia. And 2 years later, in 2022, we launched the second global RFP to cover, as I said, remaining 42 countries supported by PEPFAR, and they're presented here by many flags. Contracts for the Wave 2 pool of countries, global SLAs, were signed in spring 2023. Now we're implementing the program globally in all PEPFAR-supported space. And where we are now in this journey is 2024. We want to promote adoption of SLA model beyond PEPFAR-funded mechanisms and beyond PEPFAR programs. And so we are interested in sharing our knowledge, expertise, and hope that other countries who demonstrate interest and readiness to implement this can benefit from our knowledge and our support. Next slide, please. So these are the 50 countries, 48 countries that I talked about. Don't want to spend too much time on that. Majority, half of those countries, more than half, are in Africa, but we also have 10 countries covered by these global SLAs in the Latin American Caribbean region and in Asia and Europe. Next. So what is PEPFAR's SLA? What's included in them? So a service level agreement, as many of you know, it's not a new concept, but it's a concept that we were able to bring to next much more advanced level, but it is essentially a contract between a service provider, vendor, in this case we would refer to them as the supplier, and an organization, a buyer. In our case, it was Global Health Supply Chain PSM project that I work in. And so whereby parties have to abide by defined conditions which they contractually have to meet. And so establishment of an SLA between the buyer and the vendor provides a platform which sets the service terms of the contract, establishes standardized evaluation criteria, and the buyer then can and will assess performance of the vendor on a regular level. In our case, service level agreement is not a standalone contract. It exists under the umbrella of what we call basic ordering agreement, but it's essentially a framework contract that lays out all foundational elements of the procurement and supply process. So our global service level agreements are annexes to this framework agreements. So if we go to the next slide, very briefly, what's the difference between framework agreement or basic ordering agreement and service level agreement, which is the focus of our today's talk. So in a basic ordering agreement, you would have a period of performance, duration of the contract specified. You will list products that you intend to buy from a supplier under this framework. You would specify your packing and shipment, packaging requirements. You would specify details of the delivery process and what documents are required for that. Inspection and acceptance of goods is discussed. Payment terms, invoice requirements, warranties, dispute resolutions, and conditions or situations upon which contract can be terminated. So that's an umbrella under which we have service level agreement, which talks more specifically about ordering process for goods and services, pricing details for both, about equipment, leasing terms, installation, removal of old or malfunctioning equipment, training on equipment. There are different types of trainings, different types of equipment maintenance, different types of reporting requirements from supplier to buyer and from buyer to supplier in some cases too, as well as key performance indicators. Next. So what's included in our service level agreement? The categories of it are on your left, and I already spoke about that. In the sake of time management, I'm not going to go too much into details, but what I want to emphasize is that SLA has to be as specific as possible on each of these accounts. Like if you say training, you have to say what kind of training? Training upon installation of the instrument first, then training of maybe super users, annual training refresher, or if there is a new technology or upgrade to an instrument that end users have to be trained on that too. Maintenance, what kind of maintenance? Preventative, corrective, and all other nuances I discussed. Connectivity and data reporting, automated of instrument data only from instruments to users and decision makers. Commodity and supply chain terms I discussed in the SLA, freight, logistics of delivering reagents and consumables to an agreed place per agreed Incoterm. Incoterm is actually a very interesting subject, which we hope to talk to you about subsequently, but it's actually a very interesting aspect of the SLA. And then equipment upgrades are also included in the SLA. But SLAs, all these services are, all these contractual terms, I wouldn't say worthless, but maybe not effective unless you monitor and manage them. And my colleague Fadzai is now going to share with you how we go about doing just that. So next slide, and Fadzai, over to you.
Thank you, Julia. Good afternoon, everyone, and good morning to those in different parts of the world. My name is Fadzai Marange. I am the Senior Diagnostic Advisor for the Global Viral Load Team for the PSM project, working with the USAID. As Julia just said, the SLAs are as effective as they are monitored against what we have established as KPIs. And without that monitoring, what an SLA becomes is just a document that stays on your desk, and you have no idea of what is happening to the actual contract and the services that are being provided by the suppliers. So as a result of wanting to manage the performance of the suppliers, we established 10 key performance indicators, and they fit in different categories. There is the category that covers service, maintenance, insurance, ongoing user and training. There is connectivity and data and reporting, and then the commodity supply chain. We start with the preventive maintenance, which is how many visits the supplier can do per year. Now they range between 1 and 2, and then average response time when equipment breaks down, how long the supplier takes to respond, to say they acknowledge the breakdown of that equipment. And then next is the time they actually take to attend to that breakdown, which we have targets for all of these, and they can be defined later for those that are interested. And also, when you have done a PM, we also look at how effective that preventive maintenance has been by measuring the outages that will appear on that instrument, and how many times an engineer might have to come back to a lab to make sure that they fix that instrument after preventive maintenance. If it's done well, we would expect not to happen within 3 months. And then we also look at the uptime in terms of operation of that instrument, how it's been performing in a quarter, and then the average number of invalid or error codes or failed tests, which if we have to go into detail, this is one of the critically important KPIs, because in it, there's a lot of wastage. Any invalid means a repeat. It means a delay to patient results. It means a long turnaround time, and sometimes losing that patient. So you want to make sure that all these are monitored. Hence, we have monthly checking with the supplier to make sure that these are being monitored. We go into connectivity to make sure that the instruments are actually connected and transmitting. And then we go into the shelf life of the consumables that is left as a proportion. And then also, how long does it take for a supplier to deliver an order in full and on time? So there is a total of 10 of them, and they've got targeted numbers that we perform manage the suppliers by. Next slide, please. But as Jason said earlier, we are trying to make it simple, demystify that SLAs are not really anything that is strange or difficult or complex. There are also limits to what an SLA can help a country in management of suppliers with. What is it that it doesn't cover for now? For example, for now, we are not covering point of care instruments. It doesn't mean it's impossible. It's something that can be looked at in isolation as well. There are other tests, like you are looking at your biochemistry, hematology. They can be added because it's something that can be applied. And then there are other services beyond HIV testing that we can add, especially transportation and waste management. Then there are strategic decisions that countries can do once they have an SLA in place, like vendor managed inventory, which is a process where you work with suppliers to make sure that you have reagents being delivered to place and managed by the vendor themselves. And as we also said, it doesn't take away the problems that you may have to deal with, because it's about operations and management, regardless of having that SLA in place. You still have to go through quantification in your country to make sure that you are ordering the correct quantities versus the number of people that are living with HIV and the tests that need to be done in that particular country. Next slide, please. So as we did our training and workshop in Ethiopia, we discovered quite a number of things that there were some misconceptions about SLA execution and management, and some of the myths that we thought we would outline and make sure that we say the correct facts. They are not actually limited to what we have listed here, but one of the major ones is that countries have an idea that when you do an SLA, you are actually violating the protocols for procurement, and it's unfair to other suppliers. But however, as Yulia already alluded, that we went through an RFP process where negotiations were done with all the major suppliers that were involved in this bid, and all the prices were negotiated and put on the table. And then if that is the supplier you choose to go by, then you have an SLA with them. And also some people thought it is extremely difficult to execute SLA. It's not as hard. As you see in the next slide, I'm going to outline the simple processes that you can go through to execute. And also, there is also the idea that SLA management is about the buyer, in this case, our PSM and the suppliers. But in actual fact, it actually belongs to the government. It belongs to MOH. It is a PEPFAR goal to see that private partnership relationship improved. As such, MOH must take responsibility of managing their SLAs regardless who the funder is in that country. Next slide, please. So we just want to give a summary of what has been the impact of implementing SLAs in countries that are being managed by PEPFAR this far. Since the beginning, as Yulia said, 2019, we have seen over 50 million tests procured, and we have seen a cumulative savings of over $137 million. On average, that comes to about $2 to $3 a test. We have seen an improvement in performance through the KPI tracking that we do on a month-to-month, and we have quarterly business reviews with the suppliers. We have also seen the fact that we introduced connectivity, that there's automatic upload of data that allows us to access the information that then gives us access to managing all the challenges that are associated with those instruments. It has nothing to do with the patients, but more to do with instrument data. And then we have seen a vast improvement between us as PSM and the manufacturers that we are collaborating with, to an extent that it's no longer a buyer-manufacturer relationship, but a long-term strategic collaborative approach that we hope it will be also rolled out to other countries and other organizations. Next slide, please. So like I said earlier, it's not rocket science, it's not as complicated, but there are a few steps that are involved. There are some commitments that are required, starting with change, making that decision that we would like to implement this in our country, bringing the stakeholders to the table, communicate your change theory and say, how do we go about it? And then you have a coordinator within the country. And then in order to be able to implement, we have also, through our toolkit, now prepared already a template that countries can actually use to adapt, and then start negotiating your terms, your KPIs with the suppliers. And then when you are in agreement, you add your key performance indicators, you sign off, in the hope to be able to see an outcome of improved pricing. You obviously want to negotiate until you get the best deal without exploiting the supplier, of course. And then when you have done this, you want to be able to now monitor the performance and make the suppliers accountable. But it goes beyond accounting by the supplier, because countries must also be accountable, because there are some problems that we actually pick as gatekeepers of SLAs that show problems that are happening in the lab that MOH or TWGs must attend to. And with that, majority of the data, you get it through VIPMA, which is what we call the instrument sharing agreement for data, that allows maximization of use of data so that you can get all the information and you get increased data visibility in the end. And if your country has managed to get to this level, then you know that we are at a good stage, and then you can consider improving and increasing efficiencies by taking strategic decisions such as vendor managed inventory, which you have to agree again and start on a scope of work, working with your suppliers, and you do a pilot VMI. We have a few pilots that are ongoing, and we are very interested and keen to see what the outcomes are going to be. And VMI is also another topic, if you attend in the future, that you'll be able to witness as we go with our series. Next slide, please. So what is it that is the best approach to doing all-inclusive service agreements in country? It's about really bringing every stakeholder. If that stakeholder is going to be involved in a signature of some sort, bring them to the table from the start, and make sure that everybody who is involved are also going to be committed to discussing procurement, and make sure that when you are now having the numbers and the budgets, there is some commitment of some sort. It makes the work of the suppliers also easier, because they know how to budget for that, what they are going to be working against. And it also favors in terms of pricing when you commit to certain volumes in your country. And like we said already, regular performance monitoring will strengthen relationships between the suppliers, in this case, the vendors, the customers, and then you also discover, as people are trying to sort of correct the issues that you are picking through the KPIs, you improve on efficiencies and you improve on relationships. And there is also, I will emphasize, a need to make sure that the country allows full data sharing on instrument data in order to maximize on key performance indicators. Next slide, please. So in our workshop through PEPFAR, we had a wonderful week in Ethiopia where we had over 10 countries that attended, and we had over 75 participants with 24 organizations that were represented. And we offered about 12 training sessions, over 15 hours of tutorials and one-on-ones with countries. This happened in May of 2024. We came out with a toolkit that has got all the modules, some that we are yet to share in the near future. And thanks to PEPFAR for facilitating this, because we had countries that are actually not PEPFAR managed attending this workshop, in order to make sure that those countries that have interest can go ahead and start implementing all-inclusive service agreement in their own right. Next slide, please. So this is our team that was attending, presenting. If anybody is in this group that attended the workshop, please say yes, so that we know that we still have your support. I'm going to hand over back to Julia, who will take us through our summary and next steps, and probably we will have a few questions as well if we still have time. Thank you.
Kevin,
So
sorry, I think I've been muted accidentally. So next, yeah, so next slide. So let us summarize what we have learned so far. So PEPFAR's experience with all-inclusive global SLAs for viral load testing helped to improve the generic approach to this type of contracting by including globally standardized requirements for services and pricing. And for PEPFAR, this model and this contractual mechanism has been a cost-effective way to scale up viral load and EID testing in the kind of austere fiscal environment, as we know, with donor funding, while improving services and suppliers' accountability. So while this approach has been used by PEPFAR for instrument-based testing molecular currently, it can be applied to any instrument-based testing strategy, providing that there is an enabling environment for it. KPIs are very important, and we hope to have a chance to provide you a deep dive session, in-depth session about what KPIs are and how to monitor them, but they are essential to help monitor supplier and instrument performance. In our case, it's been on quarterly basis rigorously, but also continuously through instrument data sharing agreements to get daily, weekly data feeds. That's essential to monitor and improve performance. And components of the SLA that we have them in place build foundation for adding other value-added services to your contractual relationship with suppliers, such as vendor-managed inventory and potentially other services. I can see in the chat that waste management, for example, is a big concern and a big area of interest. So, and the last slide in our presentation is about next steps. I hope, Kevin, yes. So I hope that you find this presentation interesting and relevant for your day-to-day work. And we are hoping that this introductory presentation is just the first one in a series of several that we can offer for your community of practice in the near future. So we are prepared to do it monthly in the course of the next 6 months. And in subsequent sessions, we can discuss specific technical components of SLA implementation, such as contracting and shared template for the contract, talk about pricing, how to set up this pricing per test, or inclusive pricing, how to manage your KPIs, what is VMI, how to go about placing new instruments, and much more. And in those subsequent sessions, we will include our country examples and case studies. I know that's usually the most telling way of sharing the experience and expertise. So far, in agreement with the very kind and helpful ASLM team, we are planning to have our next presentation to your community of practice on October 3rd. And that would be about KPI management. But of course, we would like to hear your feedback, and with your help, with your feedback, decide on what are particular topics of interest and what should we prioritize in terms of sequencing of our future presentation, and also in terms of how to present the content of our training modules or knowledge sharing with you. So thank you very much for your time. Francis, I think we took a bit longer than planned, but we still have about 10 minutes left for questions. So thank you very much, and that concludes our presentation.
Thank you very much, Julia and team. Very, very great session indeed. Content laden, but in a very important area. We know that without commodities, without supplies, we can't have programs running. If they have to be running with inappropriately managed commodities, then there will be very shaky programs. We'll quickly run through some questions, but I know that we have gone through the SLAs, what they are, what they are not, and their adoption that improves supplies performance. We have also been told that non-harmonized procurement practices without good guiding strategies will generally create problems for us in the supplies management space. But also the success of service level agreements is dependent on all the parties that are involved. It is not the suppliers alone or the service providers who are receiving the commodities or the funding agencies that are supporting us. It is everybody's responsibility. And so that really is such a great thing to note. Now we have so many questions coming, and Jason, thank you again for dealing with most of those questions already in the chat, but we will be taking again a few and dealing with them. I'll start with one that is sent directly to me. It's not in the general chat there. And Julia, you may want to take this. We know that for blanket purchase agreements and of course placements and these service level agreements, there are some basic contractual requirements, call them test volumes, that the receiving parties should be meeting to make business sense from the manufacturers. And I know that probably this was quite easy for you to deal with, because you're dealing with contracting at the global level and picking 5, 6 of your high volume countries in terms of PEPFAR support to start with. But if countries were to cascade this to really support the implementation of their supply chain in the other aspects of their programs, what are some of those peculiar requirements that they should prepare to meet? You can just exploratory deal with this, but I know that this is probably a question for the suppliers. But what are some of the basic requirements that countries should be meeting before they can begin thinking of dealing with these placements and service level agreements?
Thank you for the question. It's it's a very comprehensive question which touches on several aspects, such as effective instrument placements, consideration of buying versus leasing of equipment, testing demand, placement of instruments, where should they be geographically. And you also touched on the subject of volume commitment. So let me start with the volume commitment. It is desired, and the manufacturers would very much like to see that, but it's not a mandatory requirement. If country can commit to buying certain volume from suppliers, that would increase a country or an organization who is on the negotiating end, increase your bargaining power with suppliers. But it's not essential, even though if you can, please do, and suppliers would be able then to provide you with a tiered pricing which may change from year to year, depending on how much you're buying. We have a subset of this volume guarantee model, which we call volume incentive. I don't want to go into this. It's like a little teaser for your community if you want to know more about how pricing per test and price negotiation work. But volume commitment is not the only way to deal with supplies. But what the country or the buyer needs to be prepared to do is to have as accurate quantification exercise done as possible. And it is absolutely crucial that you share your demand with suppliers regularly, whatever regularity you can negotiate. In our case, we're updating our supply plans quarterly, and we share quarterly supply plan updates with suppliers. It helps them to plan their manufacturing capacity, manufacture orders specifically for us, which may reduce the lead time and increase the shelf life offered. So, but if you cannot do it quarterly, at least twice a year, provide a supply plan which is of good quality, that will help manage this contract much more efficiently.
Thank you.
Yeah.
Thank you. Thank you very much, Julia, with that. Again, one question that came to me directly before I get to those that are in the chat. And again, thank you again, colleagues, for having so many questions coming through. You can actually continue getting those questions coming through, and we'll deal with them either here or later. But there is a question on connectivity, and I know you shared with us the fact that there is the three-dimensional reporting, automated reporting that should be happening as part of the KPIs that are monitored, so that if there is errors or the volumes that are being tested, they should be relayed to both the manufacturers, to PEPFAR, and to the country team. The question that is being asked here is related to data sharing agreements, and whether in dealing with your service level agreements, this was an area that probably you needed to deal with more, because some countries may not allow easily for their data to be shared outside the country beyond just the requirements of the Ministry of Health. And so I do not know if you have some experiences that you've gone through in terms of dealing with this three-dimensional sharing of data that you may want countries to be aware of at this point in time.
We certainly do, and we even have written case studies about how we went about putting in place vendor and instrument performance data sharing agreements. But I will let Jason to comment on that. Jason, I think you would be the best person to provide perspective here.
Sure. So, I mean, there's been a couple challenges to overcome, and I know that we're not the only folks that struggle with this in regards to data sharing, or even just getting visibility into some things that are coming out of countries. A lot of that deals with the appreciation and understanding of cloud storage versus in-country server and security and encryption components that are currently available as data solutions have kind of expanded out of, in-country servers. More specifically, if we go back and look historically what is done with program data. The VIPMA, or the agreements that are linked to these service level agreements, start with a signatory for the MOH, agreeing that data from the machines can be shared with the Ministry of Health. There is somewhat of a cascade effect beyond that, where the ministry, once they're comfortable in seeing this data and can use it to inform or understand what is going on programmatically with the instruments. And again, it is only instrument data, has nothing to do with patient data. There is an opportunity to extend the visibility and even just key visibility of core areas that the ministry would like to share. This could be with PEPFAR at the country level. This could be with various stakeholders at the country level. So the ministry actually gets to determine who has visibility. And I would argue that the resistance is actually detrimental to program, particularly for the ministries, because this is essentially their program data that is getting them visibility into what's happening with the machines that are serving their populations. So the first step is just kind of understanding what the data is. I think the next step is kind of appreciating the cloud storage aspect and the encryption and the data security measures that are in play. I know that many folks within ministries, and this is something that I use to illustrate the point of using cloud storage. But most ministries actually do have Gmail, Hotmail, and various other service providers for their emails. Every data element that is shared via email through Google or Gmail is actually stored on a cloud. So a lot of the information that is currently actually residing within a country and shared even internally within country is actually on cloud storage servers outside of the countries where this information is actually being shared. So I do want people to kind of sit back and rethink their appreciation of country data leaving the country. Most of what is happening, if you're using any kind of Gmail services or even Microsoft services, all of that information is actually leaving the country anyway. But again, as it resorts or refers back to the original concept of getting information from the instruments, this is performance metrics of instrument performance only and vendor performance only. There is nothing in regards to patient data, program performance data more generally. This is strictly key variables on error codes, testing volumes, and downtime, and things that would actually inform the collaborative effort in addressing issues with manufacturers more broadly. So hopefully that clarifies.
Thank you. Thank you. It does, Jason. And I will keep it with you. Our colleagues will overshoot by about 3 minutes, and I know that this is acceptable for most of us. And our apologies for that. But there's 2 quick questions that I want us to deal with before we wind up. And Jason, I'll hold it with you. And there is a question from Tambo. And Tambo is asking, he starts by saying that most of the PEPFAR grants typically have a duration of 1 year.
Yes.
And service level agreements, are they funded to strictly stay within the PEPFAR granting period, or there can be commitments of the funds for the 1 year period that can then run a country for more than a year if the amount of funds that is within that 1 year is adequate enough? And then the second question is related to point of care testing devices. And Grace and I think Viola are asking whether the service level agreements currently are covering point of care devices, including gene experts. And if not, are we considering them for the future? Or these are some of the areas that you're leaving for countries to deal with, not necessarily the PEPFAR team dealing with it at the global level. So those 2 quick questions, and you can deal with them in 2 minutes also.
I'll try to be brief. So the first question in regards to annual funding for PEPFAR, that is true. Our pricing agreements under the SLAs are actually negotiated every few years. So the prices are developed and negotiated with the manufacturers on a 3-year kind of, and actually it's coming up on time to reconsider some of these things in regards to pricing. But what happens every single year is that we have budget allocations that are determined through PEPFAR. These are actually confirmed at the country levels and then aggregated at a global level. And these numbers are actually shared with the manufacturers. And that is how we actually establish a funding commitment. Again, I think the manufacturers realize that obviously PEPFAR funding is not guaranteed every single year, but obviously we have a history of funding these agreements. So the pricing is negotiated every 3 years based on historical volumes and pricing buckets, but the actual volume for procurement is negotiated on an annual basis based on data that's collected as part of PEPFAR budgets and I guess allocation across vendors and suppliers is determined on an annual basis too through negotiations and discussions with national lab TWGs. So it's not done in isolation. In regards to point of care, I want to give the manufacturers some props on this one because there are actually all-inclusive agreements that are available for Cepheid as well as for Abbott's MPEMA. That do include leasing terms for the MPEMA. The SLA for Cepheid, we do have one. It's been a struggle to implement, and I'm not sure how countries could potentially access it now at this point, but for 16 modules. But the additional kind of approaches under Cepheid, for example, is under their access care package. Now, it does require an additional markup on the cartridges. So all of the services that we're talking about can be accessed through a cartridge markup with Cepheid. Unfortunately, PEPFAR does not procure a significant volume of Cepheid products in comparison to what's going on in the conventional testing space. So it's been a challenge to negotiate. I know the TB does buy a lot more. They have lowered the price of the cartridge, but there's still gaps in service provision, and those need to be addressed through a cartridge markup that can be negotiated at a country level through us or through other partners that can help add a markup to the cartridge price to ensure that those services are actually available. Many countries only just buy the cartridges. Service and maintenance and other peripheral services are many times not adequately funded. So it's important to remember that if you're buying cartridges, those additional services should be procured. And the easiest way to address that is through a cartridge markup. So that is available even on the TB side. Again, with the MPEMA, there is a lease. There is a cartridge markup for all-inclusive services. There are KPIs associated with that one too. It is higher price because it is point of care, but a lot of the pricing arrangements on these point of care devices are based on the number of machines that you have and the number of tests that you are achieving. There are price points associated with testing volumes per machine, and those must be considered. It costs a lot more to do for service provision to do 100,000 tests on 300 machines versus 100,000 tests on 50 machines, because the service provision is a lot more extensive, and people need to understand that manufacturers, there's an additional cost element associated with that level of service provision that folks are expecting. So just be aware of that, and we can work with manufacturers. I think most people don't fully appreciate that level of complexity. It's not enough to put 50 or 100 or 200 point of care machines and expect adequate service provision when there aren't adjustments for the additional level of effort and costs associated with providing services for those.
Thank you. Thank you very much, Jason, for that comprehensive response. And colleagues, we've reached almost to the end. I'll just give Julia the last chance to give us the closing remarks. Julia, over to you.
Thank you very much, Francis, for your help, from your team to help us prepare for this presentation, which I said was an absolute delight for us to have an opportunity to do that. I hope it's a beginning of a beautiful friendship, and I hope that USAID and PSM will be given more opportunities such as this to deliver content which is hopefully will be less generic and more targeted towards the needs of your audience. But your feedback and your questions were absolutely essential for us. We're proud of what we do, but we cannot do it alone. We need you, we need your organizations, your countries to join this movement to improve the scale-up of molecular testing and to make a patient's life easier and the life of decision makers for HIV programs easier as well. So thank you very much for today, and I hope to see you all soon again.
Thank you. Thank you very much, Julia, and thank you everyone for keeping us slightly beyond our usual time. It was exciting and a session, and we could not stop it in the middle. Be on the lookout for our next flyer. Next Thursday, we'll have another very exciting session. And of course, we'll get back to PSM team with those that relate to keeping commodities running in our hospitals, laboratories, because like we indicated earlier, a program without commodities is no program, or it would be a very shaky program at that. So with those, please do have the rest of your day, evening, or afternoon running smoothly without glitches. And until we meet again, see you then.
Thank you, everyone.